Hi, everyone, and welcome to the Wealthy Life Podcast. We have a very special guest today. It's Tanya Jensen, and she is a nurse practitioner who lovingly joined my practice over 4 years ago. So we've had a really good run together. She's the OG, we call her, because she's been with me from the beginning. So she was one of the first other practitioners that joined the clinic. And it was really cool. As Tanya grew into her practice, she became very interested in something called Lyme disease. So that's what we're going to talk about today. But a little bit of background about Tanya. So she's also very similar to me in that she worked in the emergency room for 17 years in Green Bay, Wisconsin. You were a nurse for a while, and then the nurse practitioner?
Correct.
So she did both roles at the emergency department in town and loved her job and did a great job. But then I think she also fell in love with this specialty as I did and joined the practice and has done a wonderful job. She has a Bachelor of Science in Nursing. She has a Master's of Science in Nursing. She also has done work through the Fellowship of Anti-Aging Medicine, through the American Academy of Anti-Aging Medicine. And most recently, she has completed your training or your...
No, still finishing up.
Still
for
finishing?
ILADS?
Yeah, so for the International Lyme and Associated Disease Society, she has been in training now for, a year and a half? Would you say?
So I did a couple courses through them. I went to their conference, and then in August, I will be doing a mentorship with their physician training program.
So you're going to Chicago to do intensive training with a physician.
Yes, and
Incredible.
I will actually be the first mid-level, so NP or PA in Wisconsin, to be able to do this program.
So you're going to be the first certified ILAD
Mid-level.
nurse practitioner or physician's assistant.
Correct.
In the state of Wisconsin.
Yes.
Which is a really big deal. And I can tell you at our clinic, when any of us have Lyme patients, especially complicated Lyme patients, Tanya is like our textbook. So I hope we're not wearing out our welcome with you, but we ask her questions all the time, and she has a wealth of knowledge. So we're going to talk about Lyme disease today, because I can tell you, in traditional training, we're trained one way about Lyme disease. And then as I got into integrative medicine and functional medicine, my lens changed a bit. So we're going to talk about that. But let's start just by talking about what it is. What is Lyme disease?
So Lyme disease is a spirochete infection from Borrelia burgdorferi bacteria that stems from the black-legged Ixodes tick.
Which is a deer tick. Correct?
Yes.
And so obviously there are a lot of deer ticks in the state of Wisconsin and in other states throughout the U.S.
Correct. And Europe.
So that infection is transmitted through a tick bite.
Correct.
And the patient has to have the tick on them for a certain amount of time.
So the school of thought is the longer the tick is on, the more, the higher chances of it becoming infected, or of you becoming infected, but you can become infected just even in minutes or hours also.
I would think so.
Yeah.
And they're really hard to see, right?
Yes.
Like they're the tip of a pencil, basically?
Yes.
So you're looking at, I don't have a pencil right here, but like the very tip of the pencil. So, and they can be anywhere in your body. So obviously if it's on your back or in your groin area or in a crease somewhere, I think obviously we miss a lot of these tick bites. And then they might just fall off and you never knew you even had it.
Correct. Only 20 to 30% of people actually remember a tick bite.
And
so it's a pretty small percentage.
What are the classic symptoms? So I would talk about the classic rash and then talk about systemic symptoms people might get from Lyme.
So the typical symptoms, like in the acute phase, you'll see an erythema migrans rash, which is kind of that bullseye rash where the tick latched on. And then you could have fever, headaches, other skin rashes that are abnormal, joint pain, muscle pain.
Yeah. What do you know the percentage of people who actually get that bullseye rash?
I don't know.
I think it's definitely not 100%.
No.
I want to say it's I don't remember for sure, so I'm not going to say it. But not everyone gets the bullseye rash. And does everyone get a flu-like syndrome like you described if they contract Lyme disease?
I would say that's like the classic.
Okay.
Those are the classic symptoms.
And I would think, so I'm just thinking of the scenario where you have like a flu, you don't get the bullseye rash, and then it kind of goes away. You very
People
well
think
could have...
just think it's viral.
Think it's a viral.
Yeah.
Right. So I think that's what we see a lot in the clinic.
Yes.
Tell me the difference about testing for Lyme. So I know, I'm going to say when we were trained in traditional training, it was if you had a bullseye rash, that was diagnostic for Lyme. So you didn't even need blood testing. If they didn't have the bullseye rash, you had to do our screening test, and if the screening test comes back positive, you then have to send that test off to confirm that it's positive. And I want to say, you might not know the percentage of this, but a large number of cases are missed with that. It's the sensitivity of that test is not super high, correct?
Correct. So the problem with, the Western medicine testing is a two-tier system where you do the ELISA test. If that is positive or equivocal, then you will do a Western blot test. But the problem with those tests are they only look at one strain of Borrelia bacteria, and there's over 24 strains. So it's really only testing for one specific strain. Also, maybe your immune system just hasn't mounted in a response to the infection yet, so the banned antibodies will not be positive. So that can also be an issue with it. The other issue is there are very Lyme-specific bands that we look for with Borrelia
on the Western blot.
On the Western blot, and in 1994, two of the very specific bands, 31 and 34 band, were removed
from that Western blot test.
Western blot test. So I tend to use other testing methods that are more specific. One in particular is called IGenix. It's an independent lab that we use. It looks for multiple different strains of Borrelia. And it's much more specific. They actually just developed, it's called the AccuDart, which is an FDA-approved immunoblot that is more specific that people can just order online.
On their own?
Yeah.
Oh, that's incredible.
So
I guess I would say testing is tricky. I mean, I struggle with it with patients all the time because we can do standard blood testing, but if they haven't mounted an immune response yet, meaning it hasn't been that long since they contracted the infection, it might not show up on their lab tests. Or if it's a different strain of the bacteria, or if it's a co-infection, it might not show up on their blood tests. And then when we look to these external labs for more advanced testing, they become more expensive. So it's really a struggle to diagnose Lyme, I would say that. And we see a lot of it. Tell me about the co-infections, because we've mentioned that word several times, and a lot of people don't know what that is.
So you can contract other bacteria, parasites, viruses from ticks, Bartonella, Babesia, tick-borne relapsing fever, ehrlichiosis, anaplasmosis. So a lot of things that are not, again, tested for on the Western blot that some of these more advanced testing do cover, and they are treated differently.
And some people can actually have a co-infection and not have the traditional Lyme bacteria infection, correct? That's what I've seen in some of my tests, which is, I was very interested by that. And so basically, also, I know you're going to confirm this, but people can still have Lyme and have all of their tests be negative, or just the traditional medical test can be negative and they can have Lyme. What about these advanced tests that you're talking about? Let's say they do the IGenX test and it's stone cold negative. What are the chances that they still have Lyme?
I don't know the percentage, but maybe that it's just, again, that your body has not, you're either so immunosuppressed that your body has not mounted a response from the antibodies yet. But you can still have Lyme. I would say less likely, but yes, you definitely can.
Okay. How would you say we approach, I shouldn't say we, it is we, how do we approach treatment differently than a traditional medical system?
And
that's a big question. So you can start with the actual antibiotic and herbal treatment first, and then I'll ask you other questions.
I would say, initially we look at the patient as a whole, right, and kind of all of the things that make up your health system. So diet, exercise, stress, sleep, past infections, what else do you have like bogging down your immune system that could be affecting you, and kind of tease out, is this Lyme? Are there other things going on? And then for treatment for Lyme specifically, I tend to start with more traditional treatment with antibiotics, but pair it with herbal treatment, and then I try to get patients off of antibiotics as soon as possible and switch into herbal.
Yes, and you do the antibiotics longer than traditional course would be. So I think typically if you diagnose someone with Lyme, like when I was working in the urgent care, it would be 14 to 21 days of treatment with one antibiotic. So how do we do things differently?
So I follow ILADS guidelines. So for example, prophylaxis, meaning if you are bit by a tick, they recommend instead of like a one-time treatment of doxycycline, ILADS would recommend 20 days actually of doxycycline from a preventative standpoint. And then, I'll treat it usually 6 weeks initially for antibiotics, and then depending on your symptoms.
And you'll do usually two
from
antibiotics instead of just one.
Correct.
And that's just to target the different forms of the bacteria, correct?
Correct.
Okay.
Intracellular versus cellular coverage.
Which can be tricky because, in our practice, we're always trying to help people have healthy guts, and we're trying to get them off drugs. So it feels kind of counterintuitive sometimes when we're treating Lyme, which I think that was the reason why for a long time I really stayed away from it. But, we just ended up having patient after patient who had unexplained symptoms and really have disabilities in their life and unable to live their full life. And treatment and diagnosis of Lyme was life-changing. So that's always a little tricky though. But I have noticed, and I see with my patients that she advises me on, and the patients she takes care of, that they have their initial antibiotics, and then sometimes we have to switch them up if they're not tolerating them, and then as soon as we can, we're getting them on more of an herbal product that's going to be more gentle to their system, but also give them that coverage. But then you also layer on other therapies. So talk to me about the other, like the biofilm clear that you use, and the other agents that are not necessarily antimicrobials, but are meant for the Lyme treatment.
So biofilms, if you think of it as kind of like an invisible shield that forms around bacteria and yeast, making it difficult for the treatment to penetrate or to find the bacteria. So I'll use things to help break down that invisible shield to make it more visible and treatable. Persister cells are another thing that we look at treating and covering, usually with herbals or sometimes prescription medication for that.
I've also seen you doing a lot of mitochondrial support. So I noticed that you've been, because if someone has a chronic infection, it's going to wear down their cellular energy, basically, which is what the mitochondria are, which you guys have heard me talk about before. And so giving patients the extra things they need so that their cells work better, their mitochondria work better, they're making energy, they're detoxing. And I think detoxing is a big deal.
Is huge.
Yeah.
We can do things here as far as like IV glutathione or oral glutathione, which is a potent antioxidant that helps bind to the toxins and pull it out. Also things like supporting your immune system. So sometimes I'll use herbals that help build up natural killer cells and things to support your immune system too.
And even simple things like Epsom salts baths I've seen you recommend.
Lemon water, sauna.
So all of the obvious things are really important too. And I want to go back to that biofilm thing, because I always tell patients, I just think I like this analogy. Like if anyone has had an abscess, or even if you have a pimple that's really big, it has that kind of like hard shell around it. So when you have certain types of bacteria or infections, they're doing that same thing. They're literally trying to save themselves. They're trying to protect themselves from your immune system being able to get to them and get rid of them. And that can make it hard for the antibiotics to actually be effective against that bacteria. So I just wanted to make that point because I thought it was important. Yep. So if someone's listening to this, some people I think overdo it with Lyme, where they put everything in the Lyme category. Like everything is because of Lyme. And then some people are obviously on the other side of it, where they're like, it's very rare to get Lyme disease. They're more in the traditional medical mindset. What would you tell a patient who's having unexplained symptoms, joint pain, fatigue, brain fog, random rashes? What would be their best first step to looking into whether they have a Lyme problem or not?
I think I would recommend seeing someone from functional medicine.
That's right.
Yeah. So, because we kind of tease out, I guess, like root cause, right? So, again, do you have other like viruses, Epstein-Barr, cytomegalovirus? Do you have mold? Do you have heavy metals, other toxins bogging down your immune system? Do you have gut issues? Or is it just that you were acutely infected with Lyme? You remember a tick bite, you had a positive test, and now you're having ongoing symptoms. So I'd say treatment and like how we test and view patients is very individual based. Like no two patients are the same.
Right.
So yeah, kind of looking at
teasing everything out.
Yeah.
And I think it's important that you brought up that we look at the patient holistically. I mean, if you have a patient who thinks they have Lyme, but they're eating the standard American diet and they're sitting at their desk job all day and on the couch at night watching Netflix, and they have incredible amounts of stress, like it's not going to be very easy to treat Lyme when you have an underlying organism that is so out of balance. So we really, I think, focus on that. And I've even seen you elect to not even start Lyme treatment until you've cleaned up some of the other things, because you know
gut is a huge
gut
thing.
Health.
Because if you already have a very unhealthy gut, leaky gut, dysbiosis, and then we're adding antibiotics on top of it, it
could be a hot mess.
Yeah. It's not going to be a good situation.
So yeah, I would say, if you're a patient and you've gotten the, oh no, you don't have Lyme, and you think you have it, you just need to find a functional medicine, integrative medicine provider who's
or Lyme literate.
Lyme literate. That's really important, because 10 years ago when I, beginning stages of my practice, I didn't do Lyme at all. I did the very standard traditional tests. I did it just as I did when I was an ER doctor. And so it's something you want to have like a seasoned practitioner who has done the appropriate training, or has someone in their practice who has done the appropriate training.
I would say for me too, my Lyme journey kind of started in 2011 when I was actually sick. I was very sick with Lyme and had to seek out my own like Lyme literate provider and treatment. So I have that vantage point as a provider where I know how it feels to be the patient who is kind of looked at like they're crazy or
right.
Having all these weird symptoms and no one can figure it out. So I think that's really important.
Well, and you were really interesting, because that happened to you when you were still working in the traditional model. And you had positive tests, correct?
Correct.
And then they treated you traditionally, but then you had ongoing long-term symptoms.
Correct.
So her story is just very fascinating, because she had to drive 3.5 hours away, find a practitioner who is certified with ILADS, correct?
Correct.
And you had great results with that.
Yeah.
Right?
Yep.
So it's pretty fascinating, and I've seen you when you're with Lyme stuff before. It's pretty crazy. People. So how does someone know if they're actually done with Lyme? Like they've been treated. There's no way to know, is there?
That's a tough question. You can do retesting. It is expensive. And then, you might always have some antibodies that are still positive. So mainly I treat based off of symptoms. I also use something called the Horowitz score. So Richard Horowitz is a Lyme literate doctor with ILADS who came up with a kind of scoring sheet with very specific Lyme symptoms on it that tell me how likely or unlikely it is for you to still have the disease. So I use that throughout my treatment.
Right, that's what I love.
And it's also...
because their score goes down.
It does go down.
It does, it's pretty cool.
And because for some people they say, yeah, I guess my fatigue's better, or maybe my joint pain's better, but this actually like scores it and it asks very specific questions, so it's more objective versus they're just subjective. Yes, I feel better. No, I don't. So I'll use that, and yeah.
So there's no real way to know.
Yeah.
The other question, someone actually asked this question when we put a post out there, more about like if you get the tick on you, what you're supposed to do. Yeah. And then I have specific questions after that. So let's say you're out in the woods, you get home and you find a deer tick, you have no idea how long it's been on you.
So, well, the first thing is getting it out. You should never like put Vaseline on it or use a match or burn it. That
was a question someone had.
Okay, so it's just using a tweezers, getting as close to the skin as you can, pulling it in the opposite direction as it's embedded, and getting it out as quickly as you can. And then you can actually just put it in a Ziploc bag, and you can mail it in to a company. It's called Tick Check. Where they actually do testing on the tick to look for Borrelia and co-infections. And I think you usually get a result within 7 days.
That's pretty cool.
and it's pretty reasonably priced. So I would do that, and then always is recommended prophylactic antibiotic treatment.
Even if the testing is negative on the tick?
No, so you would start the treatment right away for that 7 days while you're waiting, and then if it comes back it's negative, you can stop it. But yeah, it is recommended to start treatment prior to in that waiting period.
One of the things the patients in the urgent care always freaked out about is that they would pull the tick out and the head would still be left.
There's not much you can do.
That's what I always told them. I was hoping I was right, but they wanted me to like take a scalpel and dig it out. I was like, no.
No, it's kind of like getting a foreign body where your body just knows what to do with it and pushes it out. There's not a lot you can do with that.
So it's mainly getting the body and as much of the head out as possible.
Correct.
Without digging into your skin, and definitely not lighting a match to your skin.
Correct.
Or anything like that. And I remember when I was growing up, my dad actually used to burn the ticks after they were pulled out.
Yeah.
Because he's like, I don't want them going back into nature, and I don't think you have to do that either.
No, you could flush it down the toilet.
Flush it down the toilet.
But no, actually you could send it in, is what you would want to do.
If it was attached to you, right?
Yeah.
Okay. How much do you know about ticks and pets? I mean, that just came up randomly in my head because I know my dogs have ticks on them all the time.
That's one of the questions that I always ask patients about, like risk for exposure. Maybe they don't remember a tick bite, but do you have animals in your house? Do you sleep with your animals? Do you spend time in the woods? Because people who sleep with their dogs have a higher chance of contracting it, because the ticks can just crawl onto you, do a blood meal, drop off, and then you would never know. So that actually can be a common reason or a common cause.
Do you think people could be bit by a tick that had the bacteria in it, and then never have symptoms? Is it similar to like if I'm exposed to influenza but I don't contract it, or Epstein-Barr virus, or norovirus stomach flu?
I definitely think so. That's also a really complicated question. Like,
I would think so.
Why do some people, why is their immune system able to fight it off or suppress it versus other patients it just kind of wreaks havoc and is ongoing? And I think that's a complicated question, but I think genetics has something to do with it. I think, what are your other exposures? So again, viruses, toxins that you're exposed to. What is your overall health picture? So I think that's a complicated question.
I think it is too, but I always think I literally grew up in the North Woods, and then I had dogs crawling all over me, slept with dogs, and I've never tested my blood. I really don't want to. I have no symptoms. So I would say, if you're a patient and you have no symptoms, I don't think there's a reason to chase it.
Correct.
And I actually, I have a family member who I did the Western blot on her, and she had a couple of suspicious bands, but she doesn't have any of the symptoms. And again, she was exposed to dogs in the North Woods. So I don't think it's something that we ever just chase to be like, let's just make sure every one of our patients doesn't have Lyme. You have to have symptoms. You have to have classic symptoms, or at least some of the classic symptoms.
Correct.
And I do see with my patients that there are people that for sure should have Lyme based on their lifestyle, but they feel great. And I'm like, I'm not going to go chase this when you have no symptoms whatsoever. Is there anything I missed that you wanted to talk about for thinking that patients would find useful? I think at the end of the notes, I will put links to some of the companies that you mentioned, like the one where you can send your tick in, and the blood test you can order on your own, because I think that's actually really powerful, because then if you do that test and it's positive, you would then come and make an appointment with practitioners like us who are Lyme literate. But is there anything else for the patients that you think would be useful for them to know?
I think it's important to understand that Lyme disease, it's called the great imitator. So it can mimic a lot of neurologic, rheumatologic disorders. It can even elevate some of those autoimmune markers that we check sometimes. It can affect every organ system. So if something just does not seem right to you, or you're just not getting better with traditional treatment or a diagnosis that you've been given, I think just having that always in the back of your head, is there something else going on? Could it be tick-borne illness? I think that's important too.
I would say, especially with rheumatological diseases or autoimmune disease, I mean, that's where we see the majority of our patients with Lyme, is that they've been given the diagnosis of one of the autoimmune diseases, and their only option is to take pretty harsh prescription drugs for it. And then we do the Lyme testing, and for those that it's positive and we are able to treat them, we've had some really good results with that. So that is definitely something that I would agree with. If I was ever diagnosed with an autoimmune disease, I would do the deep dive on all of those things.
Yeah.
For sure. Instead of taking a drug for the rest of my life.
Yeah.
Doesn't mean you might not have to in the end, so but at least do the work and make sure that you've covered all your bases. And also, like she said, if something doesn't feel right and you're getting nowhere and you're at that dead end and they're just like, well, this is just how you're going to be, you need to dig a little more.
Yeah.
With the right person.
Advocate for yourself.
Advocate for yourself, definitely. So with that being said, Tanya, thank you.
Yeah.
Tanya loves doing podcasts. She loves it. She loves being on video.
She's being very sarcastic. But I do love Lyme.
She does, but she loves Lyme, and she is the best person for me to interview about it. I would love to hear any of your questions or feedback, and we'll try to get back to you if appropriate. Definitely don't put any patient information on there or personal health history stuff. And then I look forward to talking to you guys again soon. I think we have some really good shows coming up with different types of people, and I think that's all I have to say.
Awesome.
Have an awesome day.
Thank you.
Yep.
Bye, guys.
Bye.